All right, let's do this thing. All right, hello everyone. My name is Bree Kimberline. I am a nurse here at NKC Health. I work in the Community Health and Wellness Department. Thank you for joining us. We're so glad to have you here for this presentation that touches on a deeply important and often overlooked topic, which is chemobrain, the cognitive challenges that come following a cancer treatment, and how we can support brain recovery through the core pillars of brain health is what we're going to talk about today. So let me introduce you to our speaker, Stephanie. She's got a passion for brains and she's very knowledgeable about them, and I always enjoy a good Stephanie talk. So she's been practicing speech language pathology since 2009. She works primarily in our acute care and outpatient rehab with adults. In 2021, she founded the virtual brain injury support group through NKC Health, which has connected and supported over 45 individuals recovering from concussions across the country from Missouri to California. Stephanie's passionate about community education and has shared her knowledge at events like the KU Concussion Symposium, STEM Saturdays at Union Station, and the Kansas Speech and Hearing Association Conference. When she's not advocating for brain health, she enjoys spending time with her husband and 2 kids, Owen and Mia, and cheering on her alma mater, the Oregon Ducks. So please help me welcome Stephanie Ramirez. Take it away,
Thank you. Thank you. I am very excited to be here today and yes, talk about an important topic that I think is often overlooked. I'm going to pause my video here so we can really focus on the material. So today's plan is going to be talking about chemotherapy in general. What is it? How is it used in cancer treatment? Then we're going to be talking about chemotherapy or cancer-related cognitive impairment, which is often abbreviated CRCI in the medical field. We're then going to go into strategies and recommendations for managing the effects of chemobrain or CRCI, and then talk about the pillars of brain health. So hopefully by the time we finish this talk, you will leave with some ideas for lifestyle changes or things that you would like to incorporate into your daily life that will help support your brain health. And then leaving some time at the end for questions if there are any. So talking first about what is chemotherapy. So chemotherapy is a drug treatment that uses powerful chemicals to kill fast-growing cells in your body. And cancer cells grow very rapidly and multiply much more quickly than most cells in the body. So this is an avenue that is most often used to treat cancer. There are many different kinds of chemotherapy drugs that are available, and those will be individualized to each patient. And they can be used alone or in combination to treat a wide variety of cancers. Most of us are aware that chemotherapy does come with a risk of many side effects. And we're going to talk about what some of those are here in just a little bit. And so settings in which chemotherapy may be used in people with cancer. So first of all, chemotherapy can be used as the primary or sole treatment for cancer. So it is used to effectively cure the cancer and get rid of it in the body. It can also be used after other treatments like surgery or radiation to kill any cancer cells that might remain in the body. And so when this is happening, doctors often call this adjuvant therapy. Chemotherapy can also be used to shrink a tumor before other treatments like radiation or surgery to help make those treatments more effective or even possible. Doctors often call this neoadjuvant therapy. And then it also might be used to help relieve signs and symptoms of cancer by killing some of the cancer cells. And this might be called palliative chemotherapy. So it's not going to cure the cancer, it's not going to get rid of it, but it might help with some of the symptoms. And so like I mentioned a moment ago, we know that chemotherapy comes with side effects or toxicities, as we might call it. Some of the most common toxicities of chemotherapy are myelosuppression, which is basically low platelet counts in your blood, leads to immunosuppression. So we know that a lot of people with who are going through cancer treatment or receiving chemotherapy have compromised immune systems. They may be more susceptible to illness or infection while they are getting this treatment. There are also cardiotoxicities from chemotherapy, so that is damage to the heart and the way the heart functions. There might be some peripheral neuropathy, so damage to the nerves outside of the brain and spinal cord, which often causes pain, numbness, or tingling in the hands and feet. Chemotherapy can sometimes lead to GI inflammation. It can lead to fatigue, and then it can also lead to our topic of the day, which is cognitive dysfunction. So there are 15.5 million cancer survivors alive today in the United States, and that figure is expected to reach 20 million by 2026. It is just a staggering number, but it's amazing because these are people that are thriving and surviving after cancer treatment. The treatments that we have, the chemotherapy drugs that we have, the surgery techniques, the radiation, is working. It's helping people live longer. It's helping people survive. So the more survival we have, which is a wonderful thing, we also will be dealing with more of those cancer-related treatment toxicities following the treatment, including cancer-related cognitive impairment. This is also known as the chemobrain, which most people are familiar with. This is actually estimated to affect more than half of all cancer survivors. So in 2022, they did some research and found that 30% of cancer patients experience cancer-related cognitive impairment before they start their chemotherapy. And then this number goes up to about 75% during and after their treatment. A lot of times, CRCI or chemobrain can be very subtle. It doesn't necessarily mean that a person is not going to be able to function. They just might notice some small changes, and a lot of times these changes are completely undetected by the oncology team. So unless the patient themselves brings it up, a lot of times it's not even something that is known or addressed by the by the cancer team. So a lot of you might be wondering why. Why would cancer treatment bring about these cognitive changes? And so the answer to that question is kind of complex, and we don't completely know the answer. The cause of cancer-related cognitive impairment is multifactorial, and we're going to talk about that. It's not just the chemotherapy contributing to these symptoms. However, the chemotherapy is certainly a factor in that. We know that some of the causes include chemical toxicity. So the chemotherapy is killing the cancer cells. It's toxic to the cancer cells. It can also be toxic to the rest of the body. Also can cause oxidative damage to the cells. It can cause inflammation in the body. All of those things can change how well our brain functions. Some of the big ones that we know can lead to some cognitive changes are drugs like methotrexate, platinum-based agents like cisplatin, carboplatin, taxanes like paclitaxel, doxycycline, and vinca alkaloids. So this methotrexate and cisplatin are probably the two most common chemotherapy drugs that my patients have been given. And again, while they're very, very effective at killing the cancer and taking care of that, they do lead to some of these cognitive side effects. So as I mentioned just a moment ago, the chemotherapy itself is not responsible completely for the cognitive changes. Other causes of cancer-related cognitive impairment may include things like nutrition, infection or immune system dysfunction, insomnia or fatigue, anemia, hormone changes, neural toxicity, genetics, age. If someone's older, they're going to be more predisposed to having these changes. Also, just the overall health of the individual, how frail they are, what stage of their disease they're in, the symptom burden, and then if they're going through any emotional distress. And I want you to kind of remember just generally this list, because later on when we talk about the pillars of brain health, you're going to see that a lot of these things, such as nutrition, fatigue, sleep, all of, emotional well-being, are included in the pillars of brain health because we know that they're very important for our brain to function. Our brain is not just off in its own little, box. It is part of the rest of our body. And so when we have other things going on in our body, we can't expect our brain to function as best as it can. And anyone who's gone through cancer treatment knows that chemotherapy and the treatments that they use to kill the cancer really do affect your entire body. It doesn't really isolate itself to where the cancer is. So we need to take the whole person into consideration and make sure that we are taking care of them. So stay tuned on that. Some of the risk factors for patients who are at higher risk for having these cognitive changes are cancers of the brain, cancer that spreads, or we often say metastasizes to the brain. If a patient is getting a higher dose of chemotherapy or radiation, they might experience changes or radiation therapy to the brain. Younger age at time of cancer diagnosis and treatment, or if they're increasing age, so more in the higher age groups when they get it. So very, very young, very, very old. If the brain is at all involved, or if the medication dosage is higher, we have a higher risk for chemobrain to occur. That doesn't mean that you have to have all of these things. You can just have a few of them. And some people, still experience chemobrain even when none of these are a factor. So how does the cancer-related cognitive impairment or chemobrain present? Oftentimes, patients will note cognitive fatigue. So we have, physical fatigue, but you can also have cognitive fatigue as well. So maybe even just reading through their mail completely wipes them out. They often report difficulty with multitasking or sequencing. They might feel like a word is on the tip of their tongue. They know what it is, but they can't quite find it. So they have some word finding disability. They might have some lapses in their short-term memory, or feeling like they're having difficulty focusing, difficulty concentrating on a task, or feeling mentally slow, feeling like they are having difficulty just making good decisions or learning new things, and that processing speed kind of being impacted. And again, according to the research, the signs of the cancer-related cognitive impairment might be mild and very subtle, which might make it difficult to detect. But if the patient is feeling a change, it's very important not to ignore that change and to make sure that it is addressed so that it doesn't get any worse. And again, we know that there are concerns for cancer-related cognitive impairment from mild to severe. And the mild cognitive impairment can last from 6 months to even years after treatment. So that brings concern for things like the patient's ability to participate in work, in school, and social activities. So we don't want people to be isolated how they're able to go about their daily responsibilities. Are they going to need support? And then the factor of normal aging on top of cancer treatment and the role of dementia prevention as well. So there are concerns. We don't want to ignore the signs of cancer-related cognitive impairment or chemobrain, because there is help out there. And if we can be proactive, then our patients do much, much better. So if you or a loved one are feeling like you are experiencing some cancer-related cognitive changes, it's very important to talk to your doctor. There are tests that they can do. Some of them are screeners. You might have heard of things like the MoCA or the mini mental or the SLUMS, which stands for St. Louis University Mental Status. There are also self-reported tests like the FACT-COG and the Everyday Memory Questionnaire that you can be given, that kind of screen for those perceived changes. Cognitive rehabilitation is the recommended treatment for cancer-related cognitive impairment. And cognitive rehab is often done with a speech pathologist, and a lot of people are confused about that because, well, there's nothing wrong with my speech. Why am I getting sent to a speech therapist? Well, as a speech pathologist, our scope of practice is really everything from the neck up. So your brain is a big part of that, and cognitive rehab is a big part of what we do. It's probably the majority of the patients that I see in my position in outpatient therapy. And what cognitive rehab is it's really interventions that are designed to address those problems in mental processing, strengthening the unaffected abilities, compensating for the lost ones. And it can be done inpatient or outpatient. Some places do group therapy. Here at NKC Health, we do individual therapy. It is often covered by insurance with a doctor's order. And we go over a lot of different things. So things like symptom management, different strategies, different exercises. And then if the patient needs more referrals or support or education, or if their family does, we can take care of that in therapy. So oftentimes when a patient is going through chemobrain, there are many different disciplines that can be involved. People like psychologists, neuropsychologists, occupational therapists, speech pathologists, neurologists. So getting started with therapy can help make sure that you see the right provider at the right time, and just making sure that our patients are able to improve their symptoms and improve their quality of life to make sure that they're able to do those things that they want to do. So again, just kind of going into a little bit more detail about cognitive rehab. So we help train the brain using various techniques to relearn and strengthen skills. So basically you're learning what to use what you've got more efficiently and successfully with strategies. And for those people that are having trouble with cognitive changes, we can use strategies to work around those challenges like memory aids or organization tools. We can improve our brain. Our brain adapts and changes, and it's just like any other organ in your body. It needs stimulation and daily work, exercise to help stay sharp. So we can address those specific cognitive deficits like attention, memory, problem solving, with exercise to help stimulate the brain, and also provide coping strategies, build that cognitive endurance so people don't feel quite so fatigued, and just really overall enhancing a person's confidence that they can perform these daily tasks so that they can feel mentally and physically better. And so a big part of cognitive rehab is talking about the pillars of brain health, and that's what I'm going to share with you today. So there are several different models of pillars of brain health. Some have 4 pillars, some have 6. I really like these 6 pillars because I think that they really touch on all of those areas that we we touch on in therapy. So we're going to go through each one individually and hopefully give you some good ideas of how to incorporate these pillars of brain health into your life. So again, our brain is part of our body, so we have to take care of our whole body to keep our brain happy and healthy. So the first pillar is physical activity. So we know that physical activity increases blood and oxygen flow in the brain. So when we're thinking about the inflammation, the slowing down of the cells talking to each other with chemotherapy, physical activity can be great. It helps manage blood pressure and regulate blood sugar, which is helpful for our brain to function as best it can. It also improves strength, fatigue, and balance. So we know also that physical activity reduces overall stress. It can improve your memory, and it can increase your energy. They've done some research, which is really interesting to me, that when patients were told some information and then they went on a walk, they were better able to remember that information as opposed to the patients that just stayed sedentary. So if we're dealing with all of these things, and cancer treatment often is accompanied by a lot of fatigue, sometimes also incorporating physical therapy with the cognitive rehab can be a great option for patients. And we have specifically fatigue management at NKC Health that can help those patients who are going through that cancer journey stay active. Some of the effective physical activities for chemobrain are things like yoga, tai chi, qigong. Those are, again, low impact. You don't have to run a marathon to see the benefit, but it's just mindful movement, being aware of your body, starting slow. Again, if you're going through treatment, it's probably a good idea to talk to your doctor to see if you have any restrictions. But your goal would be hopefully to do about 30 minutes, 5 days a week, if you can. If you're not doing anything, that might be too much. So you might have to start with maybe 10 minutes, 5 days a week, and work your way up. But again, it doesn't have to be something super, super strenuous. You can go for a walk, you can ride a bike, a stationary bike, yoga, dance in your kitchen, whatever, movement kind of brings you joy. But you can see those scans there. Those were actually from the University of Illinois. They looked at the brain when someone was sitting quietly versus after a 20-minute walk. And you can see that a lot more of the brain is lighting up there and functioning after the physical activity, which is pretty cool. So just like we want to stimulate our body and move our body every day, we want to stimulate our brain. And again, the patients coming to cognitive rehab have that kind of built into the therapy. But if you're not doing cognitive rehab, then just trying to get in the habit of doing one thing every day that's going to make your brain work. A lot of times our brain kind of likes routine. It kind of gets lazy a little bit. So increasing the variety of the activities that you're doing, learning something new, can be very helpful. And just thinking of your mind like a muscle, use it or lose it. So we know if we're, not using our body, our muscles are going to shrink. The brain is very similar to that. And so some different ideas that you can do for mental stimulation are things like puzzle books. Oftentimes, I recommend the variety ones. Again, so you are not doing the same thing every day, but you're getting a good variety. Things like board games, card games, jigsaw puzzles, watching a game show on TV and playing along. Those can be really good as well. Again, just kind of mixing it up every day. Learning a new game is even better because you're having to remember the instructions and comprehend the goals of the game. So that can be really great. Different creative outlets like painting, art, music really stimulate our brains. And so if those are things that are enjoyable to you, I would really encourage that. Or if you've always wanted to start a new hobby like gardening or cooking, playing a musical instrument, I think those can be really great to stimulate your brain and kind of strengthen it at the same time doing something that you really enjoy. Ultimately, I tell a lot of my patients, if you're not enjoying what you're doing, you're probably not going to stick with it. So really figuring out what the things that you like to do are. And nowadays, everybody has a smartphone, or most people do. And so there are so many different options for computer games and apps that you can use to train your brain on smartphones or on computers. Some of the big ones are things like Lumosity, Elevate, Peak, FitBrains, Cognifit. Some of those programs do have a monthly subscription, so I would really encourage you to research the different ones before deciding what you want to do and just making sure you know what you're signing up for. A lot of them, if they do have a subscription, they will allow you to have kind of a trial period to make sure that you like it. The Lumosity specifically is the one I think most people know about. I think they even had commercials for it. I do like that one because at the very beginning, they give you a test. So all of the exercises that you are given on that program are kind of ones that are geared to your level. Whereas some of the other ones, it's just going to be kind of hit or miss. And you want to find something that's going to be challenging for your brain. If it's too easy, it's not really going to do anything. But challenging, but not frustrating. So if it gets frustrating, your brain kind of likes to shut down and give up. So we want it to be challenging, but not frustrating. Other things like Sudoku and word searches, all of those, times, crossword puzzles or Wordle, those are all really good. And again, if you can kind of get in a routine of doing some mental activity, some physical activity, that can be really great. I just wanted to throw these in. These would be examples of some strategies to help compensate if someone's having trouble with their memory. So first and foremost, we encourage people to write things down. If it's written down, your brain does not have to spend any more energy to remember it. Having a consistent calendar, whether it's on your phone or a paper calendar, very, very helpful, especially for people going through cancer treatment, because you have so many appointments and things to remember. Recruiting someone or something to help you. So if you have a trusted family member or friend that can help remind you of things, or if you need something like a timer or an alarm clock to help you remember, say, to take your medications. Those would be examples of some strategies you could use. A moment ago, I said our brain really likes routine, which can be detrimental if we don't get out of the routine ever. But if you are trying to remember something, making it part of a routine can help you remember. So again, going back to maybe the medication example, always sitting down the same time every week to fill your pill box, and then making sure you take your medicine at the same time every week. Doing one task at a time. A lot of times when we try to multitask is when we see breakdowns in memory. So really focusing on one task at a time and then moving on to something else. If you have interruptions, which that's kind of life, we have interruptions all the time, having something right there where you can write it down and come back to it later, or just address it if you need to in the moment and then get back to the original task at hand. So a lot of times I'll tell my patients to kind of make a to-do list and really try to focus on one of those things at a time. Nutrition is another very important pillar of brain health. We need to give the brain the fuel that it needs to function best. So there is a heart-head connection. In general rule of thumb, if something's going to be good for your heart, it's going to be good for your brain too. So things that protect your heart and blood vessels are things like green veggies and fatty fish, berries, tea and coffee in moderation, nuts. Mediterranean diet is generally recommended for brain health. If you guys have the time, I know there's been a lot of education here at NKC Health on different diets, and so it would definitely be worth your time to look at those talks as well. I am not a dietitian, but just in general, avoiding things like trans fats and saturated fats, getting plenty of omega-3s. Going back to blood sugar, our brain can be highly affected by blood sugar. If anybody kind of has ever experienced that, when you're super, super hungry, you're probably not going to be thinking clearly or concentrating very well. So it might be good to eat 4 to 6 small meals throughout the day rather than 3 large meals. Eating across the rainbow, very helpful. Enjoying daily cups of tea. And I think something to kind of say here is a lot of people who are going through cancer treatment do not have a good appetite. They might not be getting the best nutrition. And so talking to a dietitian, very, very helpful. Making sure that you're managing your blood sugar, especially if you're diabetic. A lot of patients going through chemotherapy. Steroids are used to help minimize some of the effects of chemotherapy, and steroids will increase your blood sugar. So being on top of that and just remembering that you're not only fueling your body, but you're fueling your brain as well. A big question that I get a lot is there any specific supplements that would be recommended? Main thing here is that you need to talk to your doctor because there might be some interactions between different supplements and medications that you're on. A lot of supplements can be very pricey, and their benefits are not very well supported in the research. A lot of it is kind of inconclusive. In general, going for a good multivitamin is probably going to be your best bet. However, specifically things like folic acid, vitamin B12, vitamin D, magnesium, fish oil, those ones are the long-standing ones that are believed to preserve and improve brain health. So again, you might talk to your doctor to see if you're deficient in any of these things. And if you are, what they would recommend you do. There have been studies of things like vitamin E, ginkgo biloba, different things, turmeric. And again, there's just really not a lot of conclusive results to say that these supplements help your brain. There is no, unfortunately, magic pill that's going to help your brain function. There's a lot of things on the market now that claim to do that, and I would just very highly encourage you to do your research before investing in anything like that. Okay, the next pillar of brain health is going to be socialization. So we know that companionship and being around other people helps keep our memory sharp. It can improve our mental function by as much as 75% and just increase our general quality of life. When you're going through cancer treatment, a lot of times you can't be around people. So they, have seen an increase in depression and loneliness in those immunocompromised patients who might not be able to go out as much as they used to. So finding ways that you can stay social while also staying safe, very, very beneficial. And going back to our pillar of brain health for physical exercise, you're more likely to exercise if you're doing it with someone. So that one can kind of kill 2 birds with 1 stone. So some ideas for socialization, I think just making the commitment that you're going to spend time with someone on a regular basis, quality time, and finding something that you enjoy doing together, or maybe for that mental stimulation, trying something new that you've never done before. again, if you can't see somebody in person, there are so many ways in this day and age of technology where you can call, email, FaceTime, even writing letters can help you stay connected. And who doesn't want to get a nice letter in the mail instead of a bill? Um, so I think that really goes both ways. Volunteering, if you are interested in something, joining a club or social group to find people who are interested in some of the same things that you are. Here in Kansas City, we have a lot of amazing local community centers, senior centers, YMCA, the Shepherd Center, places that are geared towards creating connections. There are lots of group classes around those places, along with NKC Health. We have lots of different group classes that you can take. The community colleges are a great option for that as well. There are benefits, I would say, of social networking in places like Facebook. If you, again, are not able to get out and connect with people, you can still maintain that connection as long as there's a healthy balance between that and, seeing people. Just getting out there, getting to know your neighbors, going to the movies, going to the park, other public places. If you're able to do that and just give yourself the opportunity to be around other people, you might be pleasantly surprised and maybe even make a new friend that you didn't have before. So just kind of making that commitment that you're going to try something new. Our fifth pillar of brain health is sleep hygiene. And this is so important, not just for people going through cancer treatment, but the most recent data showed that 20 to 40% of the US population is sleep deprived, meaning they're not getting the recommended 7 to 8 hours of sleep per night. So this is a problem across the board, and sleep is vital for our brain to function the best it can. Sleep is directly linked to several body and brain functions, including things like concentration, productivity, problem solving, emotional health, blood pressure, that blood sugar again, our immune function, our digestive function, so many things. And anyone who's ever had children and kind of gone through that infant stage where you're up all hours of the day and night can probably attest to that. Your brain was not functioning as well as it normally would when you're not getting good sleep. And I know I've given an entire presentation on sleep before, so you guys can feel free to look that up on our YouTube channel as well. But lots and lots of very important things on sleep. Just some general tips to help train your body to sleep better and have more quality sleep is to try to set up a regular sleep routine. So getting up and going to bed plus or minus about 20 minutes at the same time every day can be very helpful. If you feel like you're having trouble sleeping at night, you might want to avoid naps during the day. And if you feel like you're laying in bed awake, most neurologists will tell you try not to lay in bed awake for more than 5 or 10 minutes. Get up, sit in a chair in a quiet, dark room, and then when you get tired again, go back to sleep. But we want our bed to be associated for sleeping, not being awake. So in the same token, don't watch TV or read in bed, trying to avoid substances that might interfere with sleep, like caffeine. Exercising regularly will also help your sleep, and making sure that we set up our sleep environment to be nice and comfortable, quiet, maybe hiding the clock if you're a clock watcher, and then having a consistent pre-bedtime routine where, again, as we go through that routine, maybe stretching, maybe taking a shower, brushing our teeth, our body is kind of tuned in like, yep, it's time for me to go to sleep. So lots and lots of information about sleep hygiene out there. if you feel like you're following the sleep hygiene strategies and you're still struggling, this would be another thing that I would talk with your doctor about, because there are other things they can do to help. And again, sleep is vital for just our overall function. Our last pillar of brain health is taking control of your health. I would say physically and mentally is very important. So we want to continue to get recommended health screenings, managing chronic health problems, treating hearing or vision loss, reducing the risk for falls, and limiting alcohol and tobacco. So again, when you're going through cancer treatment, a lot of other things kind of get put on the back burner. But I think in your journey and your recovery, whether that is to complete remission or whether it's just kind of a maintenance, very important to stay on top of other things. Again, your brain is part of your body, so we want to help make sure we're taking care of that body. And then mental health as well as stress management is included in that overall health. So just some general tips. We want to pace yourself, and if you're feeling any depression or anxiety, make sure that those are addressed. Planning ahead, staying organized to help prevent stress, and using relaxation techniques when you are stressed, and just giving yourself grace. We know life comes with a lot of stress, and we can't prevent that completely from happening, but there are things we can do to help kind of check in with ourselves. And again, kind of going back to technology, there are lots of apps out there that can be used to help maybe with some relaxation techniques, with meditations, sleep stories. A lot of my patients have used the Calm app. And again, I do believe that one does have a subscription cost associated to it, but it does have a trial period that you can decide if that is something that you are interested in. And just kind of a little reminder, if you are feeling like you're trying these things and you're still having trouble or struggling with your mental health, definitely important to talk to your doctor about that as well, because we know that going through cancer treatment, patients that have a positive attitude and outlook tend to do better with treatment. And we want to make sure that you come through your treatment and are able to enjoy life and, you know, just really have that quality of life as well. So it's, I think, thankfully becoming less of a stigma going and getting mental health services, but it's definitely something I think that everyone going through cancer treatment should consider, just because of all the stress that does come along with that. And so finally, I just wanted to leave you with some general resources. NKC Health, we have so many different opportunities for education, and these talks, our YouTube channel, the events page for opportunities to have health screenings and learn different things, collaborate with people. So definitely check that out. If you're going through cancer treatment, the National Cancer Institute and the American Cancer Society have great information on their websites. And going back to the mental health, being involved in support groups can be super, super helpful. I think collaborating with people who know what you're going through and who have walked that path or are walking that path can be just invaluable. So Gilda's Club is a great option. There are different support groups through the Mayo Clinic, through Cancer Care, the cancer support community. And so you can look those up online, and they are very, very good resources. So I will end there. I just have a few quotes along the side to just remind you that, you know, there is hope and you are not alone in this. And as much as your body might feel broken going through cancer treatment, you are not broken. You are breaking through and you are coming out stronger on the other side. So just want to give you that encouragement and my contact information as well. If anyone has any questions that they have, I can address those now, or I can address those later if you want to talk to me privately.
Thanks, Stephanie. So much information. Good stuff. I've noticed there's kind of a theme. A lot of what Stephanie speaks on, it's not all cancer, it's not all dementia, but basically there's this core system of brain health, which are those 6 pillars that she goes over. Pretty much every single presentation I've seen you do touches on those. So I think if you can lock those in, put down the foundation, right?
Yep, setting yourself up for success, that's for sure.
You mentioned several things about nutrition. I wanted to give you guys that are watching some more information about that. If you go to our YouTube channel, which Stephanie did great plugging that, on March 10th, we had one of the oncology dietitians, Angela Boxberger, spoke about fueling the fight, nutrition's role in oncology care. Highly encourage you to go back and look at that because she touches on a lot of anti-inflammatory and protein building, things like that. So go check that out. There's also a lot of other cancer-focused presentations, and we have a lot coming up as well. So just search our page, go to nkchealth.org, look at classes and events. There's even a filter on there that says cancer, so you can filter just to the cancer options. Yeah. Does anybody have any questions? Throw them in the chat or the Q&A. Do you feel that as a caregiver, this is probably a difficult, taking care of someone with cancer, a loved one with cancer, period, that's very difficult. But if you're starting to see these cognitive changes, these mental changes, would that be something you'd probably recommend seeing the doctor about? And then to see a speech pathologist, do they need a referral?
Yes, so great questions. Answer to the first one, if you are a caregiver and you're noticing these things, I do think it's very helpful to talk to the doctor because, again, a lot of these things that you're experiencing or your loved one's experiencing, rather, can be helped and then addressed early on before they become more of an issue later on. And so if the doctor is in agreement and says, yep, we think we want to work on this, address this, they can send a referral and we will get the evaluation set up. Excuse me. We do need to have a referral from the doctor to see a patient. So that is also, the answer is yes.
And I think the same thing is accurate for a referral is needed to see a dietitian as well. I don't think that most physicians are going to go, no, I don't think that's a good idea. I think this is just a support system surrounding this whole diagnosis, right? So use all those key team members that are going to help you. Why not?
100%. I think I have walked this journey professionally with my patients, but also personally with my father who's going through cancer treatment. And I think that the thing that I've taken away is that you are your best advocate. And, a lot of times the oncology team doesn't want to overwhelm patients. And so they won't throw all of this at you right at the beginning, but instead kind of wait to see what comes up. And if you have questions or concerns or you want additional resources, all you have to do is ask. And they're more than happy to provide those. But again, different patients walk different journeys and have different responses. And so I think that you just have to advocate for yourself and what your individual needs are.
The cancer journey is so overwhelming with not just emotionally, right? But financially, your health is declining, you're stressed out. I think all the appointments, my grandmother went through cancer treatment. And just the sheer amount of appointments and knowing where to go and when to go and who's the resource, you've got to have that person on your team, on
Hmm.
at your side, like I'm sure you're that for your father, Stephanie.
Hmm.
How people do it without that core person to help them, it would be very, very difficult. So if you maybe have somebody in your corner, just grab onto them and help them walk you through this because you need support.
Yeah, and I will say a lot of the nurse navigators are
Yes.
phenomenal and really fill that role so, so well. But it's very overwhelming. If you have someone who can come with you to appointments to kind of hear the information as well, and kind of process through that, that would 100% be what I would recommend. But if you don't, really leaning on your care team and having that dialogue. A lot of places you can call, you can message in the portal, there's support lines you can call 24 hours a day. So just knowing that there are resources out there for you, and you should absolutely take advantage of that.
All right. Well, thank you, everyone. This is being recorded and we put it up on our YouTube channel. So if you're watching this, you're probably watching it on YouTube. Please go check out our other events coming up. Please reach out to Stephanie with more questions or if you want more resources. And I hope you guys have a great one and we'll see you next time.
All right.
Bye.
Thank you.